all facing some level of uncertainty and stress during this pandemic, and it's having an impact on our mental health. But how do you know when it's time to get professional help? News 3 anchor Jessica Larche shares a candid conversation with a nationally renowned psychiatrist.
All of us are feeling some bit of anxiety and maybe feelings of depression during this unprecedented time. But how do you know when it's time to reach out to a mental health professional?
I look at the timeline. So if it becomes very persistent, so if your bad days are starting to outnumber your good, that's a good way to gauge how you're doing. And I also look at if it's starting to affect other things. So if it's affecting your relationships or it's affecting the way you're doing your work, like you're not as productive now, those are the things that we pay attention to. So there's a timeline and how it affects your daily functioning.
Right now, in the middle of this pandemic, how do you go about reaching out to find a mental health professional? Because it can be daunting and really nerve-wracking for someone who's never seen a therapist. So how do we do it right now?
Right. So a lot of people think because of what's going on that it's harder to get into a therapist. It's actually easier now because we have more options. There's more people you can see, and the issue of distance is no longer an issue. So you can do everything virtually. Since about over a month now, I've been just doing virtual sessions. And I always say there's nothing wrong with looking for a therapist that you think would be a great fit for you. So if you prefer a female, if you prefer somebody who works in a specific, has specific expertise, all of that is okay. And there's lots of kind of sites that you can go to. I know Psychology Today is a great one where you just type in what you want and you can even put in your insurance and it can tell you who's listed in your state. So same way you go and you look at it because all of us are doing it virtually now.
We've talked about my experience with anxiety. I'm certainly keeping up with my therapy sessions right now, but you found that your clients, your patients who've experienced anxiety are doing okay right now.
It's very interesting because it's like they already have the tools in the toolbox. They know what this anxiety feeling is like, so they know the skills to cope with it. Whereas there's people who have never experienced this level of anxiety, where this abrupt change in our lifestyle has just brought on this whole new wave of anxiety that they've never had before. But I've noticed that people who have had experience in getting better and coping with it are actually doing better in terms of being able to cope with the daily fears.
And you can also reach out to your primary care physician for a list of therapist recommendations. And we have a link to the Psychology Today therapist database right now on WTKR.com.